today's COVID vaccination program. Well, we'll introduce the speakers to you. We have Secretary for Civil Service, Mr. Patrick Neep, as well as Professor Sophia Chan, Secretary for Food and Health. Mr. Neep, please. Good afternoon, everyone. The COVID-19 vaccination program started on the 26th of February. It's now the 18th day. Overall speaking, the operation has been smooth. As at 1 p.m. Today, there are altogether 198,100 people who have received their first dose. It accounts for about 3% of population age above 16 because that's the age when you can receive the vaccination. It's been quite worrying given that there is the recent outbreak with the gym cluster. The number of cases has increased rapidly. People are concerned. No one wants to see a non-stop of outbreak. In order to resume societal as well as economic activities and to go back to our normal lives as well as to come out of the epidemic, we have to do our best to try to bring the number of deaths as well as serious complication cases caused by COVID-19 to a minimum. We have to try to control the epidemic as best as we can. Apart from observing good personal hygiene, we have to get vaccinated as soon as possible. We're very lucky because we have a sufficient supply of vaccine, we have a choice, and we have more and more centers being put to operation to do the vaccination. There are people who would like to get vaccinated as soon as possible. On the other hand, there are also people who are waiting to see what will happen. Starting from tomorrow, there will be an additional 12 centers offering Comirnaty vaccine. Every day, the capacity of vaccination will increase. By then, there will be 8 centers offering Sinovac, 19 centers offering Comirnaty. On top of that, there are about 2,000 private clinics offering the Sinovac vaccine. The government understands that a lot of people would like to get vaccinated as soon as possible. They are disappointed because they are not part of the priority groups. We have considered the supply of COVID vaccine as well as the operation of a vaccination program. We've decided to expand the scope of priority groups so that more people will get vaccinated as soon as possible to protect themselves and to protect others. The scope of the vaccination program will be expanded to those between the age of 30 and 59. There will be 2 additional groups. 1. Students aged above 16 studying overseas and domestic helpers. After the expansion, the priority groups will cover over 5.5 million people. That is, over 80% of the population above the age of 16. Starting from 9 a.m. tomorrow, those in the priority groups will be able to visit the dedicated website to access the online booking center to make a booking with any of the community vaccination centers, 18 general outpatient clinics of the hospital authority, as well as to make a booking. They can also go to private clinics to get the jab. With the age eligibility being lowered, all you need to do is to show your proof of identity that you are above the age of 30. You don't have to separately produce work certificate or proof of work. This is a more simplified way to make a booking, and it will also streamline administrative work for individual sectors. Those above the age of 30 accounts for the majority of our working population. A lot of people would like to get vaccinated as soon as possible. On top of that, there are a lot of domestic helpers taking care of elderly people, children, or people with disabilities. There are also part-time domestic helpers working for over one family, including domestic helper is suitable. With more and more centers being put to operation and with the accumulation of experience, we make available a large number of places for booking. Currently, we offer 23,000 places for vaccination. There are also 1,400 private doctors covering about 2,000 locations offering the Sinovac for vaccination. With the pandemic, all over the world there are close to 3 million people who died because of COVID. All the countries agree that vaccination is the most effective, efficient, and feasible way. So far, over 340 million doses have been administered. That includes Sinovac and Comirnaty that are being used in Hong Kong. The more people that are vaccinated, the more effective our work to fight against the epidemic is. But if you hesitate, it will delay the resumption of normal life. We have to believe in science. We have to get an accurate understanding of the protection offered by the vaccination and possible side effects, and to know the risk posed by not getting vaccinated. I appeal to you all to get vaccinated as soon as possible to protect yourselves and others and to help Hong Kong get out of the epidemic. I will now defer to Professor Chen about monitoring and as well as other areas.
Members of the public and friends of the media, since the beginning of the COVID-19 vaccination program started on the 26th of February, more than 190,000 members of the public have been given the first dose of vaccine. Our target is very clear. That is, we will follow the priority recommended by the Joint Scientific Committee under the Center for Health Protection to gradually roll out the vaccination program and expand the priority groups so as to provide vaccination for all Hong Kong people. Since the beginning of the inoculation program, we have been following the guidelines laid down by the WHO. We have set up a pharmacovigilance system for monitoring adverse events after immunization. We have gradually collected the adverse events after immunization as reported by medical workers and also the pharmaceutical industry. Last Friday, we have published the summary reports on adverse events. The results shows that the inoculation progress is fulfill our expectation and is similar to other places. There are no particular reasons for us to worry that vaccination might lead to unexpected unfavorable events. There have been individual cases of critical cases and fatality after vaccination. According to our surveillance system, the Experts Committee on Clinical Events Assessments after COVID-19 immunization would gather the relevant data and follow the guidelines laid down by the WHO to assess the causality relationship between the cases and vaccination. So far, their study shows that there is no causality relationship between vaccination and the events. A meeting will be convened again, and also a conclusion will be drawn after the full autopsy report is available. According to our established assessments and surveillance system, from the medical and scientific point of view, there is no evidence for us to question the safety of our vaccines. I reiterate, the two vaccines we have in Hong Kong are safe, efficient, and are with quality assurance. Lately, the epidemic has seen a rebound. I would like to urge members of the public to get vaccinated as soon as possible so as to protect yourselves, family members, the public, as well as our medical system. So far, it is the most effective weapon against the COVID-19 pandemic. In other places, tens of millions of people have been given the two COVID-19 vaccinations that we have in Hong Kong. The initial results show that the mass inoculation program is very effective. It can effectively reduce the number of cases of severe illness as well as fatality. And it seems that it will help to minimize the spread of disease in society as a whole. We are still awaiting more empirical data to accurately evaluate the efficacy of the vaccines. However, I can say very clearly, the more people getting vaccinated, the more people will have the protection of antibodies, and it will be more likely that we can slow down or even intercept the spread of COVID-19. And also we can control the epidemic in Hong Kong as soon as possible. For high-risk people, for example, elderly people, those with chronic diseases and other high-risk factors, the risk for them can be drastically lowered, and we will have more room to resume societal and economic activities. Since the 18th of February, we have been gradually and orderly relaxing social distancing measures. Not long after that, we have seen the restaurant cluster, and last week we have the gene cluster. So far, more than 100 confirmed cases are related to this cluster. As you can all see, after relaxation of social distancing measures, there is a chance that the epidemic would rebound locally. If the situation still fluctuates and the confirmed cases number remain at a high double digits, together with a low inoculation rate, we may have to tighten the social distancing measures again for the sake of public health, or even consider closure of relevant venues. On the other hand, if the overall inoculation rate is high and the public joins hands in complying with the measures, for example, wearing masks and using leave home safe when they go out, then we may consider further relaxing the restrictions on restaurants and other businesses premises. Those premises which are required to close now can be reopened, schools can be fully reopened, and also activities can be resumed for sports venues. In the light of the international trend, the overall inoculation rates in Hong Kong, as well as whether an individual has been vaccinated, will be key to whether we can travel abroad and whether quarantine measures for cross-boundary travelers can be relaxed. If the inoculation rate is not satisfactory in Hong Kong, you can imagine that other places will not be very willing to resume traveling with Hong Kong. This is a very critical moment. We need everyone to fight the epidemic with us and to actively join the vaccination program so that we can resume normal operation. Of course, we will closely monitor the overall inoculation rate, which is very critical for whether we can relax our social distancing measures. Compared with other places, like the Secretary said, we are very fortunate because we have procured enough vaccines for our members of the public, like influenza vaccination. The vaccines for COVID-19 has a shelf life, especially for BioNTech. I urge members of the public to get vaccinated as soon as possible. Otherwise, you may lose out on the chance to be protected and the vaccines will be wasted. To allow members of the public to better understand the inoculation progress, we will publish the inoculation rates for the entire population and for different demographic groups on our website as indicators. I urge everyone to get vaccinated to protect yourselves and others, and also as to raise the inoculation rates.
Now the floor is open for questions. Please identify yourself and your organization before you ask any questions. I'm from Ming Pao. First, the two vaccines, Sinovac as well as BioNTech, what are the number of booking? Apart from the bookings made, how much is left in our inventory? When is the next batch coming? What is the number? You have now increased the number of people in the priority groups to 5 million. Is there any chance that supply cannot catch up with possible demand? Second question. Why did the government decide to greatly increase the number of people eligible for vaccination? Is it the case that in the past 3 weeks, the turnout rate is not as you have expected? At the beginning, you thought that 2 million people would get vaccinated. Has this target been met? How will you restore public confidence? Some people said that, well, perhaps you can give us information about background incident rate in the past few years of different diseases. Would you do that? Just now, Professor Chen talks about relaxation of certain restrictions. What is the level you think we should reach before that any relaxation? We heard that there are some preliminary confirmed cases that work in the American consulate. But however, they make use of diplomatic exemptions to not get quarantined. Is there such a thing? They don't, because they live in a dynasty court. Is there such a mechanism? How do you deal with it? First, in relation to the supply of vaccine, the first batch, Sinovac, 1 million doses, it has reached Hong Kong. For Comirnaty, 1.34 million doses have reached Hong Kong. So we have now a supply of 2.3 million doses. That's basically sufficient for 1 million people to get vaccinated. We have a timetable for transportation. In general, every month there will be a batch of vaccines arriving in Hong Kong. So we don't expect any problem with the supply of these two vaccines. We'll closely liaise with the vaccine suppliers. For Sinovac, you only have to store it in a fridge with a temperature between 2 and 8 degrees Celsius. So the storage requirement is not as stringent. However, for Comirnaty, it has to be stored at a temperature of minus 70 degrees. When it is taken out of the freezer, at the temperature of 2 to 5 degrees, it can only be stored for about 5 days. And after dilution, it will only last for 6 hours. So we have to make very good use of vaccines. Otherwise, we will be wasting valuable vaccines. Anyway, we have sufficient supply of vaccines. For the 7 vaccination centers of Comirnaty, they have opened. On top of that, another 12 will open. So altogether, there will be 19 with Comirnaty. In relation to Sinovac, there are 8 operating. At the end of March, there will be another center opening. These centers are not being put to use yet. For these 2 centers, one will offer Sinovac, the other one will offer Comirnaty. So in general, the centers are in more or less full operation. From now on till the end of March, we still have available time slots for booking. There are about over 300,000 places. Every day, there will be about 20,000 places available for booking. So that is the availability of booking or vaccination. What we need to do is make sure that everything will go smoothly. Starting from the 26th of February, after 18 days, we know that in general things are going smoothly. Regarding the number of people who have received vaccination, perhaps given recent incidents of serious adverse events following immunization, maybe people's enthusiasm has been dampened. That's why we are confident that we have the spare capacity to expand the scope of priority groups. People not in the priority groups ask when they will get vaccinated. We have taken every factor into consideration, and now we decide to expand the scope of the priority groups to allow more people to get vaccinated and to make better use of available resources, say for example available manpower as well as vaccination centers to get everything done and to maximize the effectiveness. As I said at the start, we have to plan carefully by building in flexibility. We will monitor our daily situation and make timely adjustments. This time round, we further expand the scope because of this. We believe that by allowing people above the age of 30 to get vaccinated, there are people from different professions asking when they'll get vaccinated, including reporters. Now we make it possible for them to get vaccinated. We hope that they will make good use of our vaccination program so that more people will get inoculated as soon as possible. Confidence issue. The most important thing is science and data. For any adverse events, we have an established mechanism in place to deal with them. And assessments will be conducted to see if there is any direct or indirect causality. Everything will be taken into account. If you're talking about ischemic stroke or myocardial infarction, last year there are about 10,300 and 3,700 admissions last year. So you have to look at it against this big picture. Of course, experts will look into it before arriving at a conclusion. I hope that these figures will give you the confidence you need about our vaccines. All the vaccines are safe and effective. That's the prime concern. I now defer to Professor Chen. Regarding supply, we've been liaising with suppliers of CoronaVac and Comirnaty. We have an orderly supply of the vaccines. There are no problems. I've said many times to the public, we have no problem with supply. We appeal to the public to get vaccinated. If you are concerned, go to see a doctor and get vaccinated after you've seen a doctor. The second question is about data. As Mr. Nip said, we have to believe in science and by taking into account data. The Department of Health collects data regularly. Different scientific committees have been looking into the information. So far, there is no data showing that certain conditions will be aggravated and there are more incidents after immunization. The other question is about premises. There are certain premises that are open while some others are still closed. As I said, the more people that have been inoculated, the better. This will increase the level of protection as a whole to our population. Of course, it will be quite some time before we can achieve herd immunity. We all have to chip in. When we all have antibodies, it will be conducive to the control of the virus, and it will help with our fight against the epidemic. This will also reduce the chance of transmission. We appeal to the public to get inoculated. At the same time, for premises that are open or closed, well, if there are more people that have been inoculated, then we will consider, of course, we will, on top of that, we will consider whether we will require frequent testing. And we will also consider about other areas. Of course, we have to take into account how many people that have got the jab, and we have to consider expert opinion. We'll continue to do that. Once again, I appeal to you all to get inoculated.
Concerning the compulsory testing notice issued yesterday to the Dynasty Court, there are 2 preliminary positive cases. We will deal with these cases very carefully. We will treat these cases as confirmed, just like confirmed cases. They will be required to undergo quarantine as soon as possible, and also we will find the close contacts as soon as possible and quarantine them as well. For tracing of close contacts, we are even tracing the close contacts of the close contacts. They will also be required to undergo quarantine, or rather compulsory testing. That's why we have been communicating with the U.S. Consulate. The Department of Health is doing its work. We will follow our mechanism, and the Department of Health is conducting all the works, including quarantine and testing for the close contacts of these preliminary positive cases. When we have the latest updates, we will report to the public as soon as possible. Next question, please.
So firstly, about the inoculation rate, you said around 200,000 people have got their first dose, and currently there are 3 million people eligible, so that's around 7%. What do you make of this inoculation rate? And if people are not so enthusiastic or even reluctant to get vaccinated, letting more people become eligible help drive up the inoculation rate? And what are you doing to try to make people more acceptive of the jabs? For example, will you consider doing more promotion or education, or even providing incentive? And secondly, you said that there are 12 more vaccination centers opening tomorrow. So what is the maximum number of jabs that can be given each day if all centers are running at the full capacity? And what's the current utilization rate? You said that the BioNTech jabs are difficult to store, and if not used properly, they will be wasted. Are any jabs being wasted at the moment? And yeah, that's it. Thank you.
Okay, thank you very much. At present, close to 200,000 people got their first jabs. The most important thing is that we have the vaccination venues, we have the vaccines available, and make the necessary arrangement for those who wish to be vaccinated can get the vaccine. By setting priority groups, of course, would let those with a high priority could come forward first. But based on the experience in the past 18 days, we noticed that there are still capacity to handle more, and there are people who do not belong to the priority groups but who wish to be vaccinated early. So the present expansion of the priority groups to include those aged 30 and above, basically is to make more people, who wish to be vaccinated can get the vaccines, and also to streamline the administrative arrangements. By so doing, people need not, provide the proof of their occupations or the companies or the sectors that they belong. They just show their ID card and make the online booking and then get the jobs. So it will make the whole process, smooth and more efficient. So we'll continue to monitor the progress. Of course, our target is to encourage people to get vaccinated, and our plan is still to have most of the people get vaccinated by the end of this year. So we are working towards that target. 12 more centers administering BioNTech will be open in operation tomorrow. We monitor the utilization rate. So in the past few days, we noticed that for BioNTech vaccines, more than around 90% or 92% is the utilization rate. That means that for those people who make the booking, over 90% came forward and get vaccinated. It doesn't mean that we would have a wastage of vaccines, particularly for the BioNTech, because the actual operation, I mean the colleagues in the center, they closely monitor the number of people showing up, and then they would then make the arrangement to do the dilution and withdrawals. Particularly when it comes to close to 8 p.m., say after 7 p.m., they would closely monitor the number of people showing up, and then they would do the dilution and withdrawal. In Chinese, they say 即叫即徵, and so that you can monitor, the number of vaccines are really required, and then you utilize the vials and get the dilution and withdrawal. And by so doing, with this meticulous monitoring and planning, we can minimize the vaccines that could not be used. So we'll continue to do that. As regards the capacity, as I mentioned, with the opening of the 12th center tomorrow, by the end of this month, 2 vaccines altogether, we still have more than 300,000 quotas will be made available for people making the booking.
Regarding gaining people's vaccine confidence, I think it's very important for us to understand the benefits of vaccination, let alone the vaccines that we have accredited in Hong Kong now is safe, efficacious, and also of the required quality. The benefits of vaccination, as I've said earlier, the more people get vaccinated, the faster they get vaccinated, the better that they are protected, not only as an individual, but also in a community, as well as improving or helping with the control of our epidemic situation. As we can see, after some relaxation of the social distancing measures, we already observed some outbreak. We certainly do not want to see all these different, closing down and then opening again, with all these different situations. Therefore, with the arrival of our vaccine, it is important for everybody. It would be of the best interest, not only of the individual, but also of all the sectors to get vaccinated, because with the vaccination, with more people getting vaccinated in Hong Kong, the faster we'll be able to get herd immunity, and the faster that we will be able to get our normal daily life and also our economic situation back on track, let alone all the other incentives like traveling and all the rest of it. So I think it is important for everybody to embrace, the opportunity that we have now in Hong Kong, that we can have a choice for our vaccination, and also we have enough vaccine for everybody to be vaccinated.
好，下一條問題，
Next question. The gentleman in white over there. I'm from TVB. There are more and more countries holding the vaccination program of AstraZeneca. Would you consider that? Will you hold the order of AstraZeneca If you do, how do you make up for the shortfall? In relation to the preliminary cases, the two of them of U.S. consulate, do they have the right to make use of diplomatic exemption to not do quarantine? Is it a loophole? AstraZeneca vaccine. We've signed an agreement. It's an advance purchase agreement. We understand that in other countries there are certain incidents involving AstraZeneca. We're following it up. We have immediately asked for information from AstraZeneca. We will look at the information. We will make sure that vaccines are safe, effective, and of good quality before we approve the emergency use. The advisory panel will surely look at all the data. For the two preliminary positive cases, indeed, for any preliminary positive cases, we deal with them very seriously. They will have to go through quarantine, and we will trace their close contacts and send them to quarantine as soon as possible. As to the close contacts of close contacts or their close contacts, they will be traced, and this is something that we will continue to do. Next question. The lady in pink. I'm from cable TV. Just now, it's mentioned that with the expanded scope, about 5.5 million people are eligible. There are about over 1 million doses for each of the two vaccines, and there will be more coming every month. How many more? What if all 5.5 million people choose one single vaccine? Will there be a shortage? If that is the case, who will be the priority? What do you expect the inoculation rate to be? Last time it was 3%. What is the percentage this time? You said there's a chance of tightening social distancing measures if there is a rebound. Would you set inoculation rate as one of the criteria? Currently, 6 people died after being inoculated with Sinovac, but it said that there is no direct link. Instead of halting the program, you expand the scope. Don't you think you're putting more people at risk? Would you advise people to see a doctor first? But after seeing the doctor, and if something happened, who will be held responsible? Because doctors may be afraid that they will be held liable. First, we have sufficient supply of vaccines. We expand the scope of priority groups to let more people to get vaccinated. Some people would like to get vaccinated, some others would like to wait. So even with the expanded scope and given our stock of vaccine, we think that there won't be any chance of shortage of supply. We will closely monitor the situation and make timely adjustments. I can't tell what will happen when. We will monitor the situation every day. That is a challenge of any vaccination program. We will make adjustments accordingly. We hope that by expanding the scope, we will give more flexibility to the public and make things easier for them. Well, in every age group, that some would like to get vaccinated, others would like to wait. Different people have different preference. Most important thing is to make sure that there is sufficient supply. Hong Kong is one of the rare places where people get to choose which type to use. We have a number of places that offers vaccination. We have sufficient manpower to make that happen. Everything is ready. If you want to get inoculated, you can. We have received a positive response from people who have been inoculated, whether at community vaccination centers or private clinics. The program started. There are some serious adverse events after immunization. The most important thing is to have a mechanism and to have an expert committee to look into these clinical incidents before arriving at a conclusion. They do it based on data and science. What we found was that there is immunization and there are serious events or deaths. What we need to do is, whether it is only a chronology that death or serious events happen after immunization, or there is indeed a causality. Experts will have to consider data, scientific information before arriving at a conclusion. We have the best in the field to do that. So I ask you all to leave that to our experts for them to do their job. As you all know, that this virus has a high transmission rate, and for elderly people, the death rate is quite high. So the benefits of vaccination is bigger than the risk. That's why we put in place this vaccination program, just like any other places in the world. We ask the public to make a decision. For people who have not properly controlled their health conditions, we advise them to go see their family doctor or ask the doctor in the next follow-up session. The doctors will look at their medical record and make a clinical judgment to tell them, say, when to get inoculated or whether to get inoculated. This is a safer, more proper way. You ask about social distancing measures. Relaxation or otherwise of social distancing measures depend on the epidemic. After the 18th of February, we relaxed social distancing measures in an orderly manner by putting in place certain conditions. These conditions allow us to handle the situation with more precision. We need you to do more to reduce the risk. That's the design of the mechanism. One of the conditions is for employees to get tested regularly. Why? Because for these premises, the employees come into contact with the general public frequently. So with regular testing, then we will be able to identify confirmed cases early and to isolate them early and to treat these cases early. We appeal to the employees to get inoculated as soon as possible, not just to protect themselves or their families, but to help us control the epidemic and to slow down transmission. In this way, it gives us a chance to control the epidemic. So we ask employees of these premises to get inoculated as soon as possible.
或者係
Let's take another short question. The lady in green. Hi, I'm from Oriental Daily. Just now, for AstraZeneca vaccine, you said you would continue to monitor the situation of the vaccine. When was the government planning to introduce or procure the vaccines? Will you continue to procure AstraZeneca, or are you going to consider another vaccine, that is Johnson & Johnson? Do you think you will cancel the plan of procurement if the number of fatal cases or adverse events reach a certain level? Concerning AstraZeneca, we have communicated with the pharmaceutical company earlier on. These vaccines will be delivered by the end of the second quarter. We will continue to look at the data. For a vaccine to be approved by the government for emergency use in Hong Kong, the pharmaceutical company has to submit the application and scientific data to our advisory panel for vetting. And then the advisory panel would advise the government to approve or not to approve the emergency use of the vaccine in Hong Kong. That is our mechanism. Now, there are more people getting inoculated by the vaccine outside Hong Kong. These data will be required by the administration so that we can assess the events outside Hong Kong. We have already communicated with the company for these data. Concerning procuring vaccine from another platform, like we said, we would like to procure vaccine from each platform. When we do that, we will look at the latest scientific data and also the developments of COVID-19. When we have any news, we will make it public. This is the end of the media briefing.